Comes to rotator cuff rehab, we have to be really careful not to throw around that term as a generalized terminology, because effectively there are four muscles which make up the rotator cuff, and each of them works slightly differently to each other. So if there's an injury to one of the rotator cuff muscles, we want to target the movement pattern of that specific muscle. As we start to progress through the rehab, then we can start bringing in rotator cuff activation and exercises which will allow all four muscles of the rotator cuff to work together. So just remember, early phase rehabilitation specific to an injury of one of the rotator cuff muscles, let's try and focus on targeting that movement pattern. These movements involve what's called external rotation or lateral rotation, internal rotation or medial rotation, or abduction, which is moving the arm away from the body. Now, individually, these specific movements target one or two of the rotator cuff muscles. So early phase rehab, as I mentioned earlier, will be specific to these movement patterns. As you start to get a little bit stronger, then what we can do, as you see in the later stage of this video, is incorporate movements involving all of the rotator cuff muscles. And this is usually some form of shoulder stability exercise. And as we progress, we can start moving into some of your typical strength training movements, such as press and pull patterns and movements away from the body. So whether you are early on in your rehab phase or towards the later stages, try and incorporate some of these movements into your rehab program.